Okay, I'd like to welcome up Marianne to the stage. Marianne graduated from the University of Manitoba with her Bachelor of Nursing. She started her career in adult acute medicine before working in the adult allergy. Oh, microphone. Put this down. Sorry, she started her career in adult acute medicine before working in the adult allergy and immunology clinic. It was there that she developed an interest in primary immunodeficiency, particularly in IG therapy. Marianne currently works as a nurse clinician for the Pediatric Immunology Clinic. Thank you so much. There we go.
Okay. Hi everyone, I'm Marianne, and I am the pediatric nurse immunology clinician. I do recognize some faces because I did used to work with Dr. Kalzinski and at the time Dr. Warrington, so it is nice to see some familiar faces in the crowd as well today. So my talk will be focusing on kind of the nursing day-to-day, kind of a day in the life of myself within the pediatric immunology clinic. I don't have any disclosures or conflicts of interest to report. And the objectives for my talk today is to share, again, a day in the life of myself with a specific focus on newborn screening, which Dr. Rubin has touched upon as well. And also kind of finishing off the talk with some of the frequently asked questions that I have gotten in my role currently in the pediatric program, but also in the adult side. So my talk is more geared towards pediatrics, but is also applicable to adults and how they can approach their appointments through frequently asked questions. So just a bit of a clinic overview of our clinic here on the children's side. We're located in 685 William Avenue within the HSC campus, so right beside the William Street Parkade. And in terms of the catchment of patients that we do see, it is quite wide range. Besides Manitoba, we also cover northwestern Saskatchewan, northwestern Ontario, parts of Saskatchewan, and also Nunavut. So in terms of how we can see these patients, we do see them in person, through telehealth, virtually, and also by phone. And how we decide to see these patients depends on the issues that need to be addressed, whether these appointments are initial appointments or follow-ups, where they're located. And it's really trying to, COVID did bring that about, bringing virtual appointments and phone appointments to the forefront, which has helped us also service more of the remote communities as well. So our clinic is a comprehensive clinic that looks after infants, children, and adolescents with primary immune deficiency or inborn errors. And we look after treatment and how we can improve their life. So in terms of the things that I do day to day, it all kind of focuses on the approach and the vision, mission, and values involving a kind of a patient-first and family-centered care, which follows the HSC and children's hospital approach. And within that framework, some of the day-to-day activities and tasks that I do, including checking heights and weights for patients, vital signs if needed. We'll also give immunizations in our clinic. We need to catch up children with their immunizations. We also will do allergy, skin testing to aeroallergens, spirometry testing to check for asthma. And we're really lucky within our department that we have asthma, allergy, and eczema educators that work alongside of us. So if these are things that need to be addressed within an appointment in which we're also looking at immunodeficiency, we're able to kind of walk down the hall and ask them for their help. So we're really lucky in that sense. I'll also coordinate IG treatments, teachings, and referrals. So working closely with the patient support programs, Suzanne and Dr. Kalzinski have touched upon this earlier, but we do have 3 home products that we have within the province, Cuvitru and Hizentra for the weekly STIG infusions, the HyQvia for the facilitated SCIG infusions, and will also provide IVIG through the pediatric day unit. So working with patients to make sure that they have the products that they need, and also the support that they may need in terms of being successful with their treatments. Arranging blood tests is also a big part of what we do. Dr. Rubin touched upon genetic testing and how that's kind of the new and burgeoning direction of our care. So sending out blood tests to within Canada and also the US. So we've sent blood work to Calgary, Wisconsin, Cincinnati, and the Mayo Clinic to do these different tests and to have genetic results. In terms of other sample collections, so swabs, urine tests, coordinating that. Arranging follow-up appointments and then coordinating with other specialty clinics within our center is also very important to have a collaborative approach to taking care of our patients. So working with our respiratory colleagues, our genetic colleagues, hematology, and GI, working all together with them. And then working in partnership with the newborn screening program here in Manitoba. Dr. Rubin had touched upon newborn screening for SCID. So it is a very important piece of our program, and we're very happy to have that available, which is the next part of my talk here. So our newborn screening, our part within that provincial program is looking after severe combined immune deficiency. And Dr. Rubin did touch upon that it started in September of 2020, so about 4 years into our program. And I know she did touch upon this earlier as well, but so what is newborn screening? It is the test done on every baby that is born in Manitoba with parental consent, in which a small sample of blood is taken from the baby's heel, and then we saw the Guthrie card earlier. The blood is transferred onto that card, and then that card is then tested. So the newborn screening program in general looks for rare treatable diseases, which includes SCID. And in Manitoba, there's about 40 rare disorders. Some other ones that are looked after are sickle cell disease or cystic fibrosis within this screening program. So the goal of newborn screening is to have early detection and early treatment of these rare treatable diseases. So what is SCID? Bringing it kind of back down to the basics, our immune system, as we know, is made up of cells, tissues, and organs that work together to help fight off sickness. And in SCID, it's a group of genetic illnesses that cause the immune system not to work properly. And so infants with SCID are more prone to getting repeated and dangerous infections. So again, the main goal is early detection and early treatment. So what does it mean if my baby has a positive newborn screen for SCID? So the test in which we do look at babies who are flagged as positive, they come with a low number of T cells. And these low number of T cells are a sign that your baby could have SCID. It's not a diagnosis. Again, with newborn screening, it's more so a flag for us to do further testing. So the result does not mean your baby has SCID with low T cells. Other things like prematurity or illness at birth could be a cause for these low T cells. So it is a sign for us when we get notified that we do need to do further testing. And Dr. Rubin again mentioned early treatment will lead to a very full life for these patients and very successful. So we are very fortunate to have this within our province, but also that it is tailored to be inclusive of our unique Manitoba population. So we do know the incidence of SCID is more common here in the province compared to perhaps internationally and even nationally. So things like screening for IKBKB, which is more common in our some of our Indigenous populations, and having that within our program here in the province compared to other parts of the country is very important. So I'm just going to finish off my talk with some of the frequently asked questions that I've come across. And again, it's more geared towards a pediatric population, but you could also apply this to an adult population in terms of approaching your appointments. So for instance, the first question that I'll sometimes get is, well, my pediatrician or family doctor has sent a referral. We're going to be seeing you guys. So now what? So when we get a referral from a family doctor or a general practitioner, our doctors will look at the referral and triage based on the priority of the details that are in the consult. So we may ask for blood work to be done even before we see the patient for their initial appointment, just to further triage, how urgently we need to see them. But so that's kind of what happens behind the scenes, and then we'll book the appointment to see the patient. So what can I expect during my child's appointment or even my own appointment? So when you come in, we'll do a height and weight. Specifically for children, weights are very important because a lot of medications are prescribed based on weight. So doing that. The doctors will do a physical assessment, they'll do a health history, and they'll also will do any sort of skin testing or other tests or immunizations as well. So what information do I need to tell the doctor? So even from my own experience going to a doctor, sometimes you'll be like, oh, I forgot to say this. I should have maybe included this during the talk. So even coming to an appointment with a current medication list helps. So any current prescribed medications and over-the-counter medications or even recreational drug use is important for us to know. So the child's current health history, so the symptoms that they are currently having, any previous infections, any previous hospital admissions, this is important to know as well. And specifically family health history. This is for especially the first appointment is very important because as we know, with primary immune deficiency, there is a genetic component. So something that maybe not in our forefront of our minds, but what our parents have or our siblings or our aunts and uncles are important to have the bigger picture for us to be able to perhaps get certain details that you wouldn't normally think of. So family health history is very important. Also, the current immunizations that your child has gotten is important for us to know as well. And finally, it's like, how do I prepare my child for needles, tests, and blood work? So this is a big thing because no one likes being poked. So what we do say is actually prepare your child before the visit. Let them know that this is a possibility, that it could happen. No one likes to be taken by surprise or off guard with that. So letting them know ahead of time, that there could be pokes involved, there could be blood work taken. The child's age, depending on the child's age, you could tell them, before the appointment, even a few days before if they're a little bit older, to help them prepare. And then during the appointment is comforting your child. So usually what we'll say is if they're small and young enough, is to sit them in your lap while they're receiving their immunizations or doing the skin testing. Just having them in a safe space helps relieve some of the stress that they may be feeling. Offering breastfeeding for infants before, during, or after a procedure. We also offer freezing spray or numbing cream if we're giving immunizations, all of that, and distractions. So like using toys, playing music, playing their favorite video on YouTube, all help with making the child feel more comfortable. And finally, just being positive in terms of the experience. children are very aware of the emotions, especially the emotions of their caregivers around them. So being calm and positive and will help the experience for them as well. So, after the procedure is done, whether that's testing or an immunization, giving them praise, saying, that's a great job. I'm happy that you got this done, will help kind of inform how they're going to approach further appointments in the future. So being positive does help. And with that, I'm just going to end my talk with any questions that you may have about the clinic or even just generally, mostly adults in the crowd today, about appointments in general.
What sort of ages do you start detecting like one problems for strength and weaknesses? How early can you do that? Right from infants or?
So the question was how early we can detect certain primary immune deficiencies. And so with the newborn screening, it's usually within a couple of weeks of life. So we'll get a call from CADM lab, usually 1 or 2 weeks, saying like, oh, there's a positive screen that you may need to do further workup on. We'll book an appointment with Dr. Rubin or one of the other immunologists, usually within a few days of that phone call. And if we do have, a true positive screen, meaning they do have SCID, our goal within the program is to have definitive treatment, which involves stem cell transplant within at least Dr. Rubin, 6 weeks, 6 to 8 weeks of life. 6 to 8 weeks is the goal. Yeah. When did they start screening? So the question was how long ago did we start screening children for SCID? Here in Manitoba is September of 2020, so about 4 years now.
Any other questions from the audience? Any online, Fiona? Okay. Well, thank you so much. Thank you.